medical school, and I'm not going to tell you when, because then you're going to know how old I am. We definitely, when we rotated through the pediatric ward, there was a lot of children with rheumatic fever. And the treatment at that time was bed rest. That was it was. There was nothing more. It was antibiotic and bed rest. Now convince a 7 years old like Gloria or a 3 years old to stay in bed for 3 to 4 weeks. That doesn't work. Absolutely doesn't work. And at that time, we didn't know too many things about rheumatic fever. So what I would like to do, I put a very, very little presentation. We'll talk a little bit about rheumatic fever, what's the etiology, where are we standing, where it's all over the world, and so on and so forth. And then we'll dive into Gloria's journey with valve replacement, what was available when Gloria went through the valve replacement, and what's available right now. And we'll finish with what is congestive heart failure, how we treat it, and how we monitor that. If that's okay, if I'm going to try to share the screen here. You have to give me the permission to share my screen, Florence. You are on mute.
Okay, let me see. How do I give you permission? Let's see. Share screen. I think I did it right. Do you see anything that says share screen at this point?
Yeah, that's
okay. Good.
Great. Okay. Let me see. Can you see my screen right now? Can you see my screen?
Yes.
Wonderful. So, as we said before, again, great honor and privilege for me to be part of the educational session today. And we're going to talk a little bit about rheumatic fever, valve replacement, and heart failure. So first of all, what is the definition of rheumatic fever? So rheumatic fever is a systemic disease of childhood. Usually we see it between 3 to 7 up to 15 years of age, often recurrent, that always follow a group A beta hemolytic strep infection. Now, when we speak about this streptococcal infection, it's a bacteria, and the most common one is a sore throat, an infection of the pharynx. But strep infection can show up in different ways. It can show up on the skin, it can show up with a kidney infection, and so on and so forth. But the most common one is the sore throat, and I think that's what Gloria also talked about in this respect. What happened after that, and I'll show you a couple of diagrams, this is after the infection, even the symptoms are being eliminated, there is an inflammatory response of the body, of the connective tissue, and then what happened, the body creates some kind of a mechanism and affecting other tissues that predominantly involve the heart, blood vessel, joints, subcutaneous tissue, and the CNS. So in general, as we say, it's the rheumatic fever itself causes an inflammation that you see the results as effect on the heart, blood vessel, and joints. And the symptoms, including fever, including sore throat, as we say, and the joints are very, very, very painful and tender. They are swollen, they're red, and they're usually migratory. What do I mean by that? So you can have it in one joint, and the next couple of days you have it in a second one. So it can go from a knee to a hip, to an ankle, and so on and so forth. And usually the treatment involves medication, and sometimes the medication needed for life, as I'm going to explain later. As you can see from this cartoon, this is a very old diagram, and people realize very quickly that it's a major disease that until now, it's the most common cause for death in Africa, for example, of children, developed countries in South America, and some countries in the Far East. And you can see this cartoon on the right-hand side, rheumatic fever, condemn your child heart. This is the beginning, practically it's from 1925. So, you know, even at that time, we already realized that this is a significant disease. Now, what happened, okay? So this is our bacteria, as you can see here. And through different type of mechanisms, especially the complement, that it's a protein, the body said, wait a second, I'm going to fight the bacteria and definitely develop some kind of quote unquote antibodies in order to fight the bacteria, especially the wall of the bacteria. The problem is through this process, the antibodies didn't differentiate between the wall of the bacteria and different tissue of the body. So they recognize the valve, for example, and we'll talk about the valves a little bit later. They say, wait a second, this is very similar to the bacteria. No, I am going to fight the bacteria, but at the same time, we get this adverse reaction and they attack the valve itself, predominantly the aortic valve, the mitral valve, and the tricuspid valve. So again, this is theoretically a good mechanism. The body say, wait a second, I know the streptococcus is an enemy of me. I'm going to develop some mechanism in order to attack it. But what happened, we have an inflammatory process that the antibodies now didn't differentiate between the bacteria and the tissue itself, and why they cause inflammation and activation against the valve themselves. As you can see here, we start in the sore throat, but it's definitely can affect the valve, can affect vessels, can affect kidneys. And usually we have 5 different major clinical manifestations. We usually have 5 major and 5 minor. I'll go only on the 5 major. One is the polyarthritis. That's what I spoke about, that the joints are very, very painful, red, and migratory. Then the second one that is very common is carditis. And we're speaking about an inflammation of all the layers of the heart muscle, as well all the valves. Then we have Erythema Marginatum. This is a very common rash that we can see. Chorea is a manifestation of the central nervous system. It's pretty scary, but the good things is always spontaneously recover. Chorea means that it's vulnerably movement. Patients are moving all the time like that, to the point that we cannot give and let the patient lie on a bed. We put a mattress on the floor because we are afraid, because of this movement, that patient will fall from the bed and hurt itself. The good thing is it's all self-limited and it will disappear. I've not seen one case that it didn't completely resolve, but it's very scary and the parents are very concerned about that. And the next one is subcutaneous nodule. This is a nodule that you usually see here, that it's all, as you can see here, the inflammation absolutely affect different organs. So we just go, I'm going to remind everyone, this is the simplest one that I find. I call it the Valentine heart. And I think it's good that all of us will be on the same page, and that's why I brought this diagram. So the heart consists of 4 chambers. the blue blood is coming from the two vessels, the superior and inferior vena cava, into the right atrium, go through a tricuspid valve into the right ventricle, and from here, bringing blood to the lungs. In the lungs, getting blood, getting oxygen from the lungs, coming back through 4 veins, as you can see here, and into the left atrium. From the left atrium, crossing a valve called mitral valve, and then go to the left ventricle, crossing the aortic valve into the aorta and supply blood to the rest of the body. Rheumatic fever usually affect the mitral valve and the aortic valve. What are the complications of rheumatic fever that's going to lead us directly to the aortic valve disease that Gloria had? So what happened when you attack directly the valve, again, the aortic valve and the mitral valve, what unfortunately you can cause that the valve become very stenotic, is narrowing of the valve, which result in decreased blood flow, and for the ventricle to work much harder. On the same token, the damage can be so bad that the valve can start to leak. So if we go back, now blood, when this valve has to be closed, flow go backwards to the left atrium, or if the effect is on the aortic valve, flow go back to the left ventricle. So what's now left ventricle, C is a volume overload. If the volume that should be ejected is X, now the volume that the ventricle C is 2X, and the way the ventricle is compensated for that is starting to dilate and dilate and dilate, okay? The next one, it can cause a direct damage to the muscle itself, and then beyond causing prone to the aortic valve and to the mitral valve, can cause arrhythmia, irregular, regular heart rate, and at the end led to heart failure. So I'm going to stop here, and we'll go back to, I can stop sharing, and Gloria, you can take it from here. I'm going to stop sharing. Any question? I think we should, if it's okay with you, Gloria, if people want to ask questions, please be free. You're on mute, Gloria. You're on mute.
Okay, can you hear me now?
Yes, ma'am.
Okay. Yes, I wanted to know, currently in the United States, on average during this time, how many cases do we have? Is this prevalent now, or do we have cases? Do you see cases now? And is this something that parents should be well aware?
That's a great question. So theoretically, rheumatic fever is eradicated from the United States. But I can tell you during the last decade, we have 2 areas that has a significant number of cases. The first one was in the Utah area and the mountain. And the other one, we have an outbreak in Seattle with tens of cases. And the last one, I believe Seattle was about 4 to 5 years ago, and Utah was about 8 years ago.
Okay.
The total number is very low, but as I met in the United States, but I think we have to be aware of it. I mentioned to you that I have a satellite clinic in Elmhurst. This is the center of the Hispanic population in Queens. And we have a lot of immigrants from other countries. And I have seen 3 cases in the last year of cases that came one from Guatemala and 2 from the Dominican Republic that came to us. One that already need valve replacement, and 2 of them that I think gonna need valve replacement in the future. But if you read all the publication, rheumatic fever in the United States considered eradicated right
Oh,
now.
okay, that's
What
good to
parents
know.
has to be aware, I think, I don't want to sound very alarmed, but sore throat in children,
Mhm.
I think it's a very common thing, and most of the time, it's viral. But if you have, and the pediatrician look at that, and you have pus, and you do a culture, and we can get a very quick results. You have to finish a good course of penicillin in order to avoid the rheumatic fever to go to the next step. As I said, identify the bacteria as your tissue, increase the inflammatory response, and then cause damage to the heart. So yeah, I think we should be aware if someone have a sore throat, and definitely if the culture is positive, has to be treated.
Okay, very good to know. Also, the other question I had, since I had my surgery, open heart surgery, is there another method, alternative method versus open heart surgery to replace the heart valve?
Okay, so I'm going to share my screen again, okay, if it's okay with you.
Yes.
Okay, and we're going to go. Okay, so let's take a look a little bit in the aortic valve. So aortic valve consists of three cusps, 1, 2, and 3. And you can see very well that it's fine. You can see the line between the cusps. It's very delicate. And take a look at rheumatic heart. It's really infected and inflamed. And what happened, it can cause, as we speak, it's not only that can cause narrowing, but can definitely cause leaking. And then the heart, as I said, and as I showed before, is really facing a situation that it calls volume overload or pressure overload, and a lot of times it's going to be both. So what can we do? So we can do several things. Gloria had to go through cardiac surgery in order to replace the valve, and that's involved that the valve is going to replace when the heart is on heart-lung machine or a bypass machine. During the last 10 years, there was significant development of transcatheter therapeutics. And what do I mean by that? So we can practically go through the descending aorta. You go with a little tube in the descending aorta and you go up all the way. This is the aortic arch. And we go, this is where the aortic valve is. Okay, left ventricle. This is where the aortic valve is. What happened lately is that we developed stents. I'm sure that people know what is stents, but I'll just repeat. So stents are practically like Chinese fingers. You dilate and it stays open, okay? Chinese finger, we put the finger and then we find out, and it's keeping the structure open. So what people thought, okay, first of all, what we're going to do, we're going to put a stent right here, and then we're going to implant a valve into it. And nowadays, a lot of applicants and patients are being instead of operation and open the heart and or put the patient on bypass, are using this technology. You go with a little tube into the heart. In the tube itself, we have this stent. First of all, we are putting the stent in place, and then we put the valve into the stent itself, into the ring. And then you take this one, we have a release mechanism here, and we take everything out. And this takes about an hour and a half instead of an open heart surgery that takes 6 hours and a recover of 6 weeks and so on and so forth. You can go home 2 days after that. And it's an amazing, amazing technology that developed many years, and we use it a lot. I would like to mention that it doesn't, not everyone qualified for this technology, okay? But a lot of patients really save all the aggravation, and we really minimize the risk for of open heart surgery.
Wow, that's great, Dr. Archie. Thank you so much. I do have a question that comes to my mind. It seems like a lot for you to go from having rheumatic fever to open heart surgery. And I was just blown away when Gloria shared her story with me about having a fever in childhood and then having this joint pain. And I want others to think about a question that you may have. But my question is, should joint pain and fevers be something we should be concerned about? I know it happens in childhood, but is that the primarily it happens in childhood, or if we're experiencing joint pain today as an adult and fevers, is that something that could be connected to your like aortic valve or heart disease in any way?
So Florence, just to remind everyone, I'm a pediatrician, okay? Usually you don't see rheumatic fever, acute rheumatic fever in adult population. You don't. I'm not saying there are enough diseases, just rheumatoid arthritis, you can have joint pain joint, and fever, definitely. And sometimes rheumatic fever has effect on the heart also. But rheumatic fever, the pain in the joint is very specific, as I said. It's not like rheumatoid arthritis that you have the pain in simultaneously in different joints. Rheumatic fever pain is one joint for a couple of days, then it subsides, and then the other joints start. It's very high fever. So it's very, very pathognomonic for that. Do you have other diseases in the adult population that affecting joints? Definitely pain and fever and maybe a little redness and so on and so forth. I'm sure there is, but it's not rheumatic fever. Now, I think Gloria was pretty lucky in a way that she has rheumatic fever at the age of 7, and practically she needed surgery relatively later. We usually see the deterioration of the valves relatively quickly if it's really affecting the heart. So most probably what happened, Gloria had a very, very strong heart that was able to handle either narrowing or leaking up to the point that the heart says, sorry, I cannot compensate anymore, and now we need to do this surgery or this intervention.
Are there any more questions from our audience tonight to the doctor?
I got a message that most probably the Zoom is limited in time, and we have less than a minute according to that. So
okay.
I don't know if I think there is a way to go and practically rejoin after, but just
yes, it has. Okay, it has been extended. Yeah, okay, I see the remaining time. Okay.
Okay, great.
Did we have any other questions? Florence, do you see?
No, not unless someone had raised their hand. Let me see. Are there any other questions out there? I don't see any, and I don't want to take up too much time. Oh, hi, Barbara. I see Linda. Everyone is here. Thank you guys so much for joining us on this important topic of rheumatic heart disease. If you didn't know, rheumatic fever, rather, and aortic valve replacement. I've often heard the term aortic valve replacement, but I was not able to connect the two of rheumatic fever and aortic valve replacement. So thank you so much.
I remember my mother had rheumatic fever, always heard about it. I never knew what it was. You know, she was very young and she lived, she didn't have any, I think she had congestive heart failure. She had congestive heart failure during her lifetime, but no episodes at all. And she lived to 94. So she was